Mutare, a beautiful city located in Manicaland, the eastern highlands of Zimbabwe, with a population of 1,126,579 females. Cases of maternal death and failure to lactate are rampant every day.
Netwa mbuya swela mbuya ana matwenzi proceed na succeed. Ndinozwa kubve mavhari. Maisha akarwara akasheka General Hospital. Ndobva ndafonera nemanesi eGeneral Hospital kuti uyai newana kuti vaone rubatsiro. Ndobva ndaenda General Hospital obva anditransfera kuuya kuWindows of Hope. Saka ndiri pano. Tenda neWindows of Hope wandibatsira nemukaka. Ngarambe akadaro.
Windows of Hope is an organization that is dedicated to work day and night in providing aid for these little infants.
Hi, my name is Darlington Chikami. I'm the programs manager for Windows of Hope. We deal with the assisting of orphans and vulnerable children and also sick people. As we deal with orphaned children, there is also this department that has become very prevalent. The Department of Children who need formula milk after losing their mothers, and sometimes after their mothers' breasts are affected by different ailments, which lead them not to be able to continue breastfeeding them. We work with volunteers from different communities who refer these cases to our attention, and also to government departments, namely the social welfare and the Ministry of Health through the hospitals. So we have recently experienced an upsurge of requests for the formula milk, which signifies that we are the major player in the supply of this product in the community. So we are appealing for assistance for more formula milk so that we can meet the demands which we are now failing to meet as a result of the increasing numbers, evidenced by the referrals we are getting from the provincial hospital and the Ministry of Social Welfare. In terms of the referrals, we have the Victoria Chitepo Hospital. It's the provincial hospital where all cases from Manicaland are referred to, and the Ministry of Social Welfare, this department receives requests from the general community, and they in turn refer them to us. At the moment, we are mainly concentrated in Manicaland, although we are not meeting the needs and the demands for the Manicaland province, but we also intend to get out of Manicaland and also assist Masvingo, Midlands, and even Harare, if funds permits, because a lot of children are being left behind because of the health system in our hospitals. A lot of mothers are dying, leaving behind these children. So it will be prudent for us if we could help more assistance to provide more goats in the rural areas. Especially Masvingo province is a province that can do goat rearing very well, it being a hot area. And if we can get more money to buy formula milk, we could also reach out to the town setups. When I look at the statistics, for us to adequately reach out to the needs and demands for this project, we need to be reaching out to at least 120 children per month, and each getting 5 tins of lactogen or non-milk, 400 grams. It will be enough to supply 120 children. But we also need to take into cognizance that these caregivers, some of them are also hungry themselves, the ones who look after these children. So they also need food assistance themselves in the form of mealie meal, cooking oil, and kapenda, as well as salt, and also washing soap to wash the clothes and nappies for these children.
Okay.
So I would want to thank our main partners in the provision of this formula milk, namely SIM, Saving in Mission. It has been giving us support in this area in form of money to buy the formula milk, and also Saving African Family Enterprises, that is SAFE, who have provided us with goats for the rural families. But going forward, we are also requesting for more partners to help in this, since we happen to be the main player in this aspect of formula milk.
Windows of Hope is not an island. It works with various stakeholders in the province. The Public Relations Officer of Victoria Chitepo, let's hear what she had to say.
Ntasa, the Public Relations Officer for Victoria Chitepo Provincial Hospital under the Ministry of Health and Child Care. Victoria Chitepo started collaborating with Windows of Hope in August 2020 when we had some challenges with the formula feeds to facilitate the feeding of the vulnerable orphans, dumped children, and other babies whose parents are there but cannot afford to get adequate milk from the mother. The aid that may be needed for this program to continuously kick is a continuous supply, because at times Windows of Hope, we call them, they will say at the moment we don't have adequate or we don't have anything at all. Yet at the hospital we'll be having a really need baby for the formula. So if they could have constant supplies of the formula feeds, so that we don't risk taking the babies home with no adequate supplies. That's when we have them, when they come for well baby clinic with malnutrition or signs of underfeeding. Otherwise, I know you cannot supply the hospital. We are trying as a hospital, but as if it was possible to have also some supplies for the hospital to reduce the financial constraints which are being faced by the hospital. But at the moment, we are trying to give formula feeds to the need when they are admitted.
Other key players, such as the social welfare, are also in the aid to assist these infants. Let's hear what they have to say.
Hello, my name is Robita Nyakuni. I'm a social development officer who works for the government of Zimbabwe in the Department of Social Welfare under the Ministry of Public Safety, Labour and Social Welfare. The Department of Social Welfare is responsible for every child in the district. So we normally receive cases of vulnerable children and children who have their parents who would have passed on are not spared. So when we receive those cases, we refer to Windows of Hope, who normally assist us with formula milk for the babies. Okay, per week roughly we receive 8 to 10 children who need this assistance, and some of the children will be twins and triplets. We have tools in our department that are used to assess these children. So when one meets our criteria, that's when we refer the cases to Windows of Hope for formula milk. We really appreciate the effort that Windows of Hope has been doing for our district since 2014, but we feel that more should be done for these families, since formula milk is not enough. But sometimes the family will be in need of mealie meal, washing soap for the babies, blankets for the babies, but we really appreciate their efforts Windows of Hope. Since sometimes they give us numbers together with the for the 150.
Windows of Hope staff members and the crew behind the scenes had to follow up on the assistant members. Here is what they had to say.
Ndinoitwa Jessica Mambondiani. Okay, chekutanga ndakatambirwawo mwana uyu unonzi Tainashi Zaitsi. Ndakatambirwa mwana uyu namai vake. Mwana akasvika akanoadmitwa paGeneral Hospital. So ndakazobvunzwa ikoko nenhau yekuti makadhambirwa mwana sei. Ndikavatsanangudzirawo madhambirwo andakaitwa mwana nekurwara kwari kuita. Vakandibvunza kuti saka muchachengeta mwana sei. Ndikati mwana handisi kutokwanisa kana kuti ndimuchengete nenhau yekuti pari zvinezvi handina chinhu chandiri kuita chingakwanisa kuti ndikwanise kuwanawo rubatsiro rwekuti mwana akwanise kunge achiwana zvekuti ararame nazvo zvakafanana nemukaka. Madhoktasi ndivo vakanga vachindibvunza kudaro. Ivo vakazondirifeya kuti ndizouyawo vakazondirifeya kuuya kwamuri kuWindows of Hope. Vakandipa tsamba yekuti ndikwanise kusvika kuWindows of Hope. Pandakasvika kuWindows of Hope vakandigashira zvakanaka. Vakaverenga tsamba yakanga yabva kuna dhokota. Vakandigashira zvakanaka, vakandibatsirawo, vakandipa mukaka wekuti ndikwanise kunga ndichipawo mwana uyu. Ini ndinoda kutenda pane zvandakabatsirwa nazvo.
Unoitwa Mikari naMikeka. Chikonzero chinoita kuti nditsvage rubatsiro ndanga ndine dambudziko kuti kuva ndichirwa ndakaita miscarriage 3. Saka pandakazoita kwangu ndiri ndasununguka vanhu vakakokosingamiri. Saka ndipo pandakazunguka Windows Hope vakandibvunza rubatsiro. Vakandigamuchirawo vakakwanisa kundibatsira kuti ndikwanise kuwana rubatsiro rwekuti ndipe vana mukaka. Zvakaitika 2020 ndasununguka na October wemukaka. Kubva panguva iyoyo vana vakazopedzisira kupiwa mukaka vane gore ne6. Izvezvi ndandichiwana rubatsiro rwemoyo norubatsiro rwandinowana paWindows of Hope. Ndinobikira vana porridge. Zvakawanda kubatsira kuti semadovi vaya vakakwanisa kuramba vachitibatsirawo nawo nezvimwe zvavanokwanisa kuwanisa organization. Handiziva kuti kunowanikei zvaita kana mafuta kana chii zvekungoshandisa kuti vana vakwanise kuenderera mberi because zvinhu zvacho zvinenge zvakashoma.
Windows of Hope envisions to be an esteemed organization that transforms, empowers, and develops hopeless citizens to become self-sufficient and live productive lives. Let's all be part of this life-changing program for the future generation of tomorrow. From me and the crew behind the scenes, it is a goodbye. Thank you for watching.